All right, and with that, we'll get started. So I'll introduce myself and the project team and COA, and then for the rest of the folks on the line, you can introduce yourself at your first comment when we're ready to do the interactive portion. So I'll go first, since I'm already talking. I'm Rose Newberry. I'm the project manager for JUDEC, the consultant team working on the ARP. And I'm really excited to host this meeting today and hear from all of you about your ideas about what should happen in the Clark County Age Readiness Plan. And with that, I'll hand over to Susan.
Hi, everybody. I'm Susan Ellinger. I help staff the Commission on Aging and really appreciate everybody being here today.
And then do we have any COA members on the line?
Yes, we have Mel Sanchez here.
Can you hear me?
Yep.
Okay. Yes, I'm here. Thank you.
Thanks, Mel. All right, and we'll meet everyone else in the interactive portion of the meeting, which will happen in a couple minutes. Next slide, please. So first, we want to give a little project background. Really important to mention, this plan is an update. There is an original age readiness plan that was approved in 2012, which is on the Clark County website, and it was really developed from a lot of community input. And we're really working today, and we've had multiple meetings over the past week to continue this collaborative development. And the 2012 plan included 5 chapters: living longer and healthier, housing, transportation, supportive services, and then turning silver into gold, or the important role of seniors in our communities. The 2012 plan included 91 strategies to make Clark County more age-friendly and more age-ready. And in COA, the Commission on Aging for Clark County also produced annual progress reports that tracked how the plan was doing and added new goals as things changed. Next slide. I'm going to talk about how the age readiness plan is implemented. It's a county-wide plan, so it doesn't just direct the county. It also provides recommendations to cities and towns and Clark County, as well as service providers. So it really highlights best practices and recommendations for local jurisdictions. We talked a lot in the housing group about some model ordinances, and also with transportation about coordinating different transit agencies and service providers. And it's really about providing some best practices that other places can adopt or service providers can implement. It also sets standards for community involvement. So thinking about how and when the county and other agencies talk to the community about age relevant design standards or efforts. And then most importantly, it connects planning, advocacy, service providers. If you think about someone leaving their home to go to a doctor's appointment, they're going to need a place to live. So that's housing, policy and planning, getting out of their door. Maybe they need a ramp or something. That's another element of planning and standards, and maybe service provider. Then they have to get on a city or county sidewalk. That's someone else. And then they get on maybe a C-Tram bus. It's again, someone else. So connecting all of those pieces to get an age-ready community. Next slide. So why the update? 2012 plan is pretty good, but there's a new chapter we're going to add, which is the hazards chapter, both addressing natural and human caused hazards. This will address things like the wildfires we've been seeing lately, extreme heat, which is incredibly dangerous for older adults, and then also incorporate lessons we learned from the pandemic, both the emergency stage, what a public health emergency looks like and how we should respond to that, but also how service providers have changed their tactics in the last few years in response to kind of living with COVID and what COVID looks like now in a vaccinated world. And there's also been major changes to housing, transportation, and healthcare, things like ADUs, Lyft and Uber, costs of healthcare, both from the ACA, changes to Medicare, inflation is something we've heard consistently on our other stakeholder meetings. So it's a different world than it was in 2012, and we want to address that. There's also a larger generation of retirement of folks entering retirement, which means there's a lot of people to provide for, but also there's large diversity in seniors. 60 and 100 are very different need classes, and we need to reflect the diversity in age, race, ability in our aging population. And then lastly, to monitor the progress. What's been working well, what should continue, what needs to adjust, and really kind of doing a check-in. Did the 2012 plan work like it needed to, and will the 2022 plan move forward in the same direction? Next slide. So why are we here today? We're really hoping to kind of define a problem and vision today. We're still in the early stages of writing up the plan, and we want to hear your goals build upon existing programs and assets you know about from your work, develop new policies and programs with you today that should be evaluated for the plan, and then understand the hurdles to your goals and really find those tricky issues that the plan should address. Next slide. And this is our last one before we get all talk together. We wanted to share where we are in the process with you. So we're right here in the beginning stages and focus group meetings. Some things our team has already done is done a lot of data gathering and sharing, making sure we have demographic information, stuff from the Clark County Info Map, and just to make sure we understand the available data on the ground. And we've also been reviewing the 2012 plan, ad squads, area plan, a lot of the documents that are out there to make sure this is a holistic document. And the last thing we've already started doing is starting to talk to stakeholders like you and doing some one-on-one interviews. And that will continue throughout the process, maybe with some of you, just to make sure that we're understanding the needs and abilities of the folks we depend on to implement this plan. Once we're done with these focus group meetings, you're our last one for the week, our team is going to go back over the holidays and really start working on strategies. What strategies should be included in the plan? Who we think implements them, how we know if they work. And then early in the new year, we'll come back, we'll do these deep dive working sessions. All of you and the general public will be invited to those working sessions and to really do a deep dive and dig in to the strategies our team has thought about and kind of answer some big questions. After those working sessions, we'll write up a draft plan and now have another public review period. But hopefully everything looks really familiar and is reflective of all this engagement. So we can comment again. And then later in 2023, we'll have a final plan ready for adoption. So again, really in the beginning stages, kind of trying to define what success would look like. And with that, I will start our interactive portion. So in the interactive portion, you can just unmute yourself, introduce yourself, or you can use the chat, whatever you feel most comfortable with. All right. Is everyone seeing the Jamboard? I'm gonna look to my team to give me a thumbs up. Perfect. So this is a two-parter. And what we're gonna do first is just talk really broadly about what would make a community age friendly. What is our end goal? In this plan is implemented, what should Clark County look like? You can see we have some examples here. We're really excited to see what you say. Our examples are maybe parks that are accessible and people being able to have fresh food near them. But again, just the really broad goals we have. Once we go through that takes about 5 to 10 minutes. We'll start digging into those as a team to talk about the potential solutions to make those goals happen, as well as any hurdles you've experienced into making those goals a reality. So with that, I'll open up the floor. Please just unmute yourself and talk, or type in the chat what you think makes a community age friendly.
Since nobody's saying anything, may I say something?
Yes, of course.
Okay. Whether it's a park or on your way to have a meal, I think one of the big issues we have today, and Larry Green and I were talking about this, he's a member of the Aging Commission as well, and he lives in a home for senior citizens. And he says one reason a lot of people are going into these homes is for safety. Crime is quite a, there's been an uptick on this crime. And so, you know, if you're just walking down the street to the market, are you safe as a senior citizen? If you're going to the park, are you safe? I had a friend took an elderly lady to the hospital. She had an issue. While he was in the hospital in the parking lot, his catalytic converter was stolen. You know, I live alone. I feel really safe where I live. But if you're more inner city, crime can be an issue.
Sure. Yeah. So helpful now. Thank you. I mean, as you can see, the chat has been lighting up and our scribes have been putting on the board. So other things the core product putting in the chat was social engagement, a culture of inclusion and understanding, access to affordable public transportation, which a couple of people said, so it got bigger, and then community safety, just like Mel was saying. This is great. Does anyone else have any other items they want to talk about kind of goals we should see for this plan?
I can add some. Can you hear me?
Yes, I can.
I'm Preston Peterson with Permanente Geriatrician. I think of a few things. You know, virtual care is going to get bigger and bigger, but if people don't have access to good Wi-Fi, that's going to be a problem. So access to Wi-Fi, access to devices, training on that. People, you know, if you don't have a grandson who can help you learn how to use the iPad, that can be a problem. So peers or somebody that can help with training around virtual care, and the Wi-Fi is a big piece, you know, from a DEI standpoint. A lot of people don't have access to good Wi-Fi. And maybe those are virtual care hubs or places where you could go to have the device and the Wi-Fi, you know, if you can't do that. I think of paratransit, so, you know, wheelchair vans, things like that for transportation. I think of partnerships between health plans. And so in Oregon, as an example, we partner with a company and we have mobile health partners. So we send paramedics and EMTs to the home to deliver care. But in Clark County, we can't because the EMS service won't allow it. So, you know, in terms of barriers, it's something to consider working on is, you know, why can we do, you know, kind of paramedicine to get to people who are homebound in Multnomah County, but not Clark County. So that's one. Yeah, I'll have others, but I'll leave time for everybody else.
Sure. I'm also seeing stuff in the chat, affordable and available housing, community-based supports, dementia awareness. They're great.
I would just want to build upon what Preston shared, and as we're looking to make digital healthcare more accessible, that we kind of blend that with also social engagement opportunities. When we're looking at whole person care, I think that's just such a critical part of wellness.
Yeah.
So I'd like to add, I'd like to go to this topic of fresh food nearby. I run a couple of local farmers markets, and I'm very involved in the farm community and land use issues with the intent of preserving food producing land in Clark County. I find there are a lot of issues having to do with public policy that does not favor the preservation of food producing land. A lot of pressures from development going sort of in the wrong direction from the perspective of a community that's age friendly at any rate, in terms of affordability, et cetera. So I'd like to see more done on the fresh food nearby topic.
Awesome. Yeah.
Hi, I'm Melanie Meneg. I'm from Permanente Medicine. I wanted to build in with what Dr. Preston, what Preston had to say. Oftentimes when our elderly patients come in to see their doctor, sometimes the lucky ones have someone coming in with them and expressing their needs and being able to help navigate the healthcare systems. There are an increasingly amount of patients and elderly patients who don't have that. And when they come in to talk to their doctors, they don't know where to begin or even how to express what's going on with their healthcare and what are the barriers to their healthcare. So a navigator to help them do that, that would really be a plus.
Yeah, thank you. That's great feedback. And we've heard that a couple of times, so I'm glad we're hearing some consistency. Well, this is fantastic. And yeah, Anne?
Yeah, so I just wanted to, on the topic of healthcare. So I definitely happen to be in this community of the older folks and suffering from a couple of current illnesses. And my husband upstairs is struggling with a couple of current illnesses. And one of the issues that we find, I mean, we're well cared for. We've, we're comfortable and all that. So we're very privileged from that perspective. But it's just hard to get immediate care. It's hard to know how to find it. You go to urgent care and wait for hours. Do you try to get through membership services? Do you try to get to an advice nurse? You know, hospitals are short-staffed, clinics are short-staffed, especially right now. I mean, it's overwhelming for us. So I can imagine somebody who is in a less comfortable position or by themselves, to what Christina was just saying, it's deadly. I mean, it's a deadly situation.
Yeah. Those are great additions. I'm seeing a couple of one chats, continued integration of healthcare and community-based organizations. Yeah, absolutely. Well, this is a fantastic list. If anyone has anything else, they can pop it in the chat, but we'll move on to digging into this a little more. I think will be really fun and useful. So we added all of the things you were saying to these slides. So let's kind of go through one by one, talk about any solutions maybe you've seen in other communities or just ideas you have, and then also talk about any hurdles to these solutions and problems you've seen in implementing that goal. So we can start with just social engagement and getting older adults either together or in multi-generational communities, but out of isolation, especially given the last couple of years. You know, have any solutions or hurdles they want to share?
Commission on Aging had a really interesting speaker earlier this week who was talking about some things that they're doing in CAMUS around social engagement. And it was very, there was a variety of things. So art classes and a variety of different things. We kind of looking to integrate with small businesses. So for example, for people with dementia, could we go out to small businesses? This is something that Dementia Friends is looking at. Could we go out to businesses and say, do you have times historically in your day that are maybe less traffic? And could we maybe do like a, you know, a time where a support group is coming in and having coffee together? So essentially, how do we leverage community to provide better engagement activities for older adults, whether it's in general or for specific communities?
Awesome.
Okay, as far as safety for seniors is concerned, we need to have some sort of relationship with the police force or any other agency to be aware of our seniors, that they take buses. Maybe we have a police officer that goes on buses to make sure that everyone is safe, not just senior citizens. That they make their rounds around parks. Maybe they already do it, but I think we need to have some sort of engagement with the police force and other enforcement agencies.
Yeah, it's awesome. Thank you. Any other solutions or hurdles around social engagement? Yeah, plans for in-person activities after the public health emergency, absolutely. Yeah, we can move on to our next goal. A culture of inclusion and understanding. So do they have any hurdles they've seen, maybe why there are issues creating this culture, or potential solutions? Yeah, management for social media transportation, sure. And then, sorry, Christina, go right ahead.
I referenced it earlier, but Dementia Friends, our sole purpose is to help create awareness around dementia so that individuals and families who are dealing with it feel like they can connect in community a little more often. I think sometimes there's some isolation going on because they don't know how they'll be received in community. So I think that is across the board for individuals who maybe, you know, have different disabilities or different cultural experiences, that the more we as a community can be accepting and inclusive, the better.
Awesome. Yeah, education awareness. Also in the chat, we have community leaders and decision makers embracing this as an example. Absolutely.
Didn't we just vote on something that had to do with a new office that would address this issue of inclusion and understanding? Nobody knows?
So I think that was yes, a recent item that related specifically to the county offices, but I could be wrong.
Yeah, we can dig into that. And I think we might be seeing more of that in the next 10 years too. So we can put that as an opportunity.
It was a charter amendment.
I believe so.
Yeah, and I'm not sure it passed, Mel. I'd have
Well,
to look at-
okay.
Just in terms of solutions, I know the state of Washington has resources that are dedicated to diversity, equity, and inclusion. So I think as community leaders seek to kind of broaden that in either their organizations or as leaders in kind of leading that effort in the community, that might be a place to draw resources from.
Absolutely. All right, does anyone else want to speak to the cultural inclusion and understanding before we move on to safety?
I think like doing events around the community would be a great example, like multicultural festivals. In my own school community, we've had book discussions and had group discussions about, you know, how it is to feel included and understanding diverse opinions, and maybe even having it centered with our older population. That would be good.
That's awesome. Thank you for that. All right. And with that, I mean, any more ideas also pop in the chat, but we'll move on to safety. I know Mel talked about a little bit about the police in the previous item. Is there anything else about safety or feeling safe we want to talk about as far as solutions or hurdles to that safety?
Well, this is maybe a different perspective, but I think oftentimes older adults, in terms of safety, we want to look at fall prevention.
And what will we do for fall prevention?
I think that there's a couple of things we can do. There's some community resources. So being aware of how to make the home safer. For example, Clark Cowlitz Fire and Rescue has a program where they address that. I think that there are opportunities to maybe have discussions with healthcare about how to maybe be more proactive. I think things like, you know, making sure that those vision checks are getting done on a regular basis. So all of those traditional things. I'm a huge fan of the STEDI program, STEDI. That's the program that the paramedics use. But that's something that's accessible to the general public. You can go in and get that brochure, and it's, I think, written very user-friendly for either an individual or for a healthcare provider.
Yeah, I think we also hear about sidewalks, maintenance, curb cuts, ADA. Absolutely.
But also to have hand holders in stores and on public transportation. Things that the aging community needs.
Yeah, absolutely.
If I can just piggyback on Christina, she mentioned the work of Clark Cowlitz Fire and Rescue. They have a falls prevention specialist as part of their community risk reduction and community paramedicine program. So I just did want to bring to the attention of this group that we do have community paramedicine in Clark County that's really taking off, and falls is a big focus of that.
Hey, Eric, that's fantastic.
I'll add one thing on the fall, you know, in terms of falls. I don't know how, you know, do people in Clark County have access to Tai Chi classes, whether free or low cost? You know, that's one thing that's very evidence-based in terms of reducing falls. So something to think about.
Yeah, I think just being able to better support what is out there. I know Clark College historically has offered those classes, but you know, what's the awareness of them?
That sounds like you're everything for social engagement.
Mhm.
And it hits a lot of things.
Mhm.
It's awesome.
Well, Medicare also has that availability to seniors for the use of gyms. And if we could get that in outlying areas, then maybe somebody like me that lives in northern Clark County would have that available to him and not have to go all the way to Clark College for that.
Well, Mel, I think you bring a really good point, is that so often our healthcare benefits offer some type of wellness benefit.
Yes.
And again, it's an awareness of knowing what you're, what
Mhm.
you have access to.
We've been having these calls all week and bringing on for Soul Together, and I think everyone's been learning something new. Like, oh, I didn't know we had that, and so I think that's been a real lesson for me. There's just so many good things going on, and tying them together is going to be a huge goal of this plan. Seeing some really great things in the chat about thinking about these classes. Are they accessible for people without transportation? Are they available in other languages? So I think going back to the cultural inclusion understanding, applying that lens to other solutions and making sure that they're accessible to a range of folks, geographically, socially, transportation. Fantastic. All right, does anyone else have anything else on community safety before we go to the next slide?
If I can just piggyback on David Hudson's comment about the languages and accessibility for diverse cultures, I just want to highlight what I think is an important resource that we should center, which is community-based workers or community health workers, representative of these diverse communities, because you can have all the classes you want and all the languages you want, but if there's not a connection between the people who are kind of leading that work with the communities, it's hard to really get traction. And that work of supporting community-based workforce, I think, is broadly valuable, but particularly for older, elderly populations.
Awesome. Yeah, that's fantastic.
Well, again, I'll repeat, as I did before, that there's needs to be some communication and understanding between the aging community and law enforcement, so that law enforcement will be aware that they may need extra protection as they are out in the community.
Absolutely. That's great. All right. And then, of course, any more ideas, throw them in the chat, but I'm going to get on to our next goal. We have a lot of them, which I'm very happy about. Access to healthcare. We talked about a lot of this in our previous groups, so thinking about solutions for access, and the access can be transportation, access can be affordability, and then hurdles we've seen. Certainly a hurdle we've talked about in other groups is just resources, right? Everyone's understaffed. It's really hard to get appointments. I think that's a hurdle we can start out with. I've been hearing it pretty consistently, but everyone else, if you have ideas, please jump in.
I think one of the things pre-COVID that we're also dealing with is just physical space, right? So someone shows up to the ER, what does that look like now, right? And it's, we know and we understand our healthcare partners are doing the best they can, but like, how do we move out of that, that condition where people are just, it's taking forever to get admitted or, have access because of everything else that we typically deal with in terms of health, but then in addition to that, the ongoing complications of responding to COVID. And I appreciate that things are much better now with the vaccine, but I think healthcare is still experiencing some of that burden.
Absolutely.
I was at a meeting the other day at Legacy in Salmon Creek about the farmers market there next year, but they were saying that one of the biggest problems that they're having right now is they have no place to move patients who should go into nursing care or rehab or convalescent homes. They aren't out there. That space isn't available. And so Legacy has no choice but to keep them in a bed in the hospital. So the hospital bed count is overflowing, but there's a certain percentage that could be moved into other facilities if they were available. if they're available in the community, there's such a long waiting list. And of course, a lot of that gets back to staffing shortages. So.
Well, and I think about what we're seeing in workforce, and then we take that experience that our healthcare folks have been dealing with for so long, and what is the impact to them, and what is the turnover and the burnout in the profession, and how do we help to address that as a community?
Yeah.
I have so
Absolutely.
much empathy for what they've held for the last few years.
Just on the long-term care front, I mean, these things all intersect and connect, right? So all the staffing challenges we're talking about in long-term care, they were particularly hit hard, and the beds are out there, the same number of beds we had pre-COVID, but they're not staffed beds. So they're sitting empty, and long-term care facilities can't pay up to get people to come back to work. So that's a sad reality right now. And sometimes people go to these places because they don't have other options that, in an age-friendly community, maybe they'd have. If they had a one-level place to live that was safe, no steps, they may be able to get home. If they had adequate caregiving, whether that's paid or unpaid, they could maybe go home and not to a long-term care place. So all these things are connected.
Just to expand, not only are we seeing a shortage of workforce in long-term care facilities, but in home care.
And home care.
So our home care agencies or individual providers, there is just not adequate workforce in any long-term care situation to meet the need.
Yeah. It's all really helpful points. All right. We can move to transportation unless anyone else has anything else on healthcare. So kinds of solutions to accessible and affordable public transportation, and then maybe hurdles you've seen in that.
Rose, you've heard me say this before, but accessible transportation for things beyond healthcare and essential shopping, I think is a critical need.
Well, one of the solutions we have is I believe it's called C-Tran. But there's also a hurdle because it only comes so far into northern Clark County. I have a friend that works for C-Tran, and she says they can come as far as Battleground, I think, but they don't go any further north. So to expand C-Tran, and by the way, C-Tran won the transportation year of the national award 2 years in a row. Still, they need to expand the area that they service.
Yeah. And it's just for everyone's edification, C-Tran has been a partner in this. We talked to them early in the demonstration group, so we got a lot of feedback from them as well. And we heard really similar points to Mel's. So you are certainly not alone in that perspective. Anything else about public transportation being accessible, affordable, any issues you've seen? Yeah, a hurdle to C-Tran is obviously cost. Yeah. All right, we can.
I was gonna say, so I work with a network of agencies that have community health workers, and one of the things that I notice, they work with folks around whole person care. They do risk assessment, and that risk assessment includes transportation. So a lot of times there's unidentified risk around transportation and security, and that comes up in these assessments with community health workers. So it's both a hurdle and maybe a solution that the community health workers then can work with them to connect them to resources, identify that it's a risk and create a plan. Might not be all the solution, but it's an important piece of it.
Yeah, I think going back to the education piece, and I've been learning this week all about the C-Tran Ambassador Program, that I think is you know, a lot of people were surprised to hear about it, and just making sure we're getting that information to other folks, maybe to the community health workers. It's fantastic. All right, anyone else?
Well, I just want to, I know I'm probably speaking too much, but one other thing that I'm thinking here is that the health plans, the supplemental health plans, do they have anything, you know, like they have that silver health thing where you can get the gyms, access to the gyms for free. Do they have anything, or could we lobby to get them to add transportation costs to their plans as well?
We are seeing more and more an expansion of benefits. So I think what you might be talking about are the Medicare Advantage plans.
Yes.
And some of the plans do offer transportation benefits to their client. But I don't know how universal it is in each plan. And I don't know if it's specific to healthcare related services or if it's broader than that. I suspect it varies by, you know, plan by plan with the priority towards healthcare.
Thank you for that information. Maybe we could make people aware of the plans that do have these benefits.
Yeah, absolutely. All right, again, more ideas going to go in the chat. I'm going to skip to our next goal. Broadband and training on accessible virtual care. It's kind of the digital divide and getting older adults and with disabilities access to the internet.
I wonder if there might be opportunity to do some partnering. So for example, I know Bridgeview Resource Center has a wonderful computer lab. I think that there's computers available in the library. So could we do some partnership there with maybe folks who could do that skill training? And then maybe, you know, some of the navigators from healthcare systems, is there value to kind of bringing those groups together to create some type of training?
Yeah, training is, I think, a great solution. I did in the chat, train should be written into policy, absolutely.
I would just say that you would want, I think it would be ideal to build those trainings in places where there's natural congregation already. I can tell you that we offered it briefly through our office and we really struggled to get anyone to take advantage of it. And I think it was because it was so dependent upon the individual to recognize like, oh, this is a service that might benefit me. And then, you know, move forward with the requesting it versus if it's at, you know, a Vancouver housing site or a public library, I think there's just a natural audience there to build upon.
Yeah, absolutely. And I can add a hurdle to this, definitely cost. I mean, everything's very expensive and add cost to every hurdle, but I know that my Wi-Fi bill is very expensive. If you're on a fixed income, maybe you don't think that that additional $100 a month is worth it. And anyone else with additional hurdles or opportunities around access to the internet or learning how to use those systems, including virtual care?
I'll add one more, and that's the availability of Wi-Fi, et cetera, to these more rural areas in basically northern Clark County. Some people they just don't have those services available to them. You know, they have to use a satellite, and sometimes that's not available either.
Right. Yeah.
Well, and I think, you know, processes have to be really clear. So I know there's, you know, there's a service that folks have to apply for online. And then that older adult needs to be aware of the fact that they have to go in and renew once a year, because if they don't, they get removed from the list. And I think that's a pretty big lift for someone who's not already technology savvy to have to be, you know, aware of that, and then, you know, create some type of reminder for themselves of like, oh, I have to go back in and complete this process again. So I think just that we're mindful of the expectations that we're setting and that they are user friendly.
Absolutely.
I think one hurdle I'd like to bring up, and this is based on experience partnering with ADSWA actually, in COVID, we worked together to develop a series of accessible short videos to support folks who were not familiar or savvy with technology to gain familiarity so they could use that. And, you know, the feedback from community were that these were good videos and accessible. And the challenge is always when you have these resources, how do you get them in front of people? How do you support engagement with these resources? It's a need. Here's one potential solution, but that connection is really difficult to make and sustain.
Yeah, that's really helpful. All right, unless we have anything else, we can move to mobile health partnerships. And I heard a lot about paramedicine earlier, so any potential solutions you see in other communities or hurdles we want to mention here.
I just want to sing the praises of Clark Cowlitz Fire and Rescue. I think they're doing a great job with their community paramedicine program, and you know, they're kind of really branching it out. There's several different things that they're doing under that umbrella. And so we're just really happy to partner with them, and it's been a really nice partnership as well with Swatch. So I think more work in that respect and that type of partnering and braiding of funding should continue to evolve.
Awesome. Yeah, partnerships. Clark Out's already doing well. That's great.
I'll piggyback on what Christina said, and also to say that at this point, we have one fire district who's providing community paramedicine in the 3 counties that Swatch anyway works with, Skamania, Klickitat, and Clark. And I think there's an opportunity here to build on the work that Clark Cowlitz Fire and Rescue has done, and they're ready champions to help expand the program with other fire districts. And that's an opportunity to explore how best to do that is kind of next steps.
That's awesome. Yeah.
I think, you know, maybe a little beyond the mobile health partnership is really taking that time to understand where each community is and that care delivery model that they're using. So for example, in Klickitat County, while I'm not aware of a mobile house, they do now have palliative care. And so, you know, because that's something that their community could stand up. So making sure that we're really checking in with the local stakeholders to understand what can you move forward, what are you passionate about, and you know, seeking to build upon that.
Yeah, making sure things are best fit. They make sense. Absolutely. Yeah, I'll try to take this down. I can move on to our next goal. We had a lot of goals. Affordable and available housing. There's the big one, and we did have a housing meeting, so I can jump here too and tell you what we've heard. But do you want to talk about affordable and available housing? I'm happy to start us off. So things, and we can also move on to the next one, but things we've heard, and the housing focus group was thinking about the cost of retrofits and building homes, you know, 0-step entries and wheelchair accessibility from the start. Thinking a lot about both retrofitting older homes and how to pay for that, as well as building new homes that meet those needs. Initially, we talked a lot about you know, rising costs and inflation, rentals, getting roommates, diverse age groups, and then some hurdles being education, best practices, and kind of making sure everyone's aware of universal design. So with that, I don't have any other comments on on housing affordability?
I'm sorry, but I have one more, and that is
Mhm.
we should have a list of the different types of housing that is available and distinguish the different types that there are: senior communities versus rehab communities versus hospice versus, there's a variety. I don't know them all. I've dealt with some of them recently because of family members, but we need to have a list of the different type and definition of the different types of housing.
Sure. Yeah, absolutely. There's definitely a very large range, especially based on ability and level of care.
I do think some of this regarding housing is going to go back to public policy and decision makers. It's a complex process, but the availability of housing isn't always necessarily connected to affordability. Affordability tends to be more the market, developers' costs, et cetera. But, where housing is, and to Mel's point, maybe we sort of switch his idea around and say, let's feed to the decision makers the kind of housing that we need and where we need it and what that needs to look like. Instead of taking what's out there and trying to figure out a list from that, let's just turn it around and say, let's just feed this to the people who are making decisions for this county.
Yeah, so an inventory of needs, thinking about that
Right.
long-term availability. Absolutely.
Right.
Anyone else want to talk about housing?
It's a mess. That's-
And then I'm seeing Preston in the chat encouraging models such as Villages Northwest and collaborative housing communities. It's awesome. We talked about that a lot in the housing meeting. Some different ownership models and how housing could meet more of a range of needs.
Can I add one piece, is that I think that what we know is that oftentimes housing services, because they're limited, they need to be triaged. And what this means is that oftentimes the rising risk folks who still have housing but aren't necessarily as dire as others do not receive the support that keeps them from getting into that worsened position. And I think we know that this is an issue, but I think it's an important one to call out because it's a classic, missing the upstream opportunity to deal with acute crisis.
Yeah, that's fantastic. Not the issue, but your point. Yeah, we can move on to dementia awareness. I know, Christine, you talked about the work in Camas with Dementia Friends. We talked in previous meetings about education. Is there anything else I want to talk about for how to increase dementia awareness?
We're always happy to do education awareness and offer the information session. We just need to be able to access more partners to do that. And then just to clarify, the Camas initiative is more aimed at social engagement, then dementia awareness is available throughout Clark County.
Thank you for that. All right. Anyone else want to talk about dementia awareness? All right, and of course, if you have any other ideas, pop them in the chat. Community-based supports for elders in home, a community for social, physical health, and behavioral supports. Does whoever added this to the goal sheet want to kind of elaborate on and kind of define that issue for us?
Sure, I put that in there. I think just calling out that oftentimes services require that folks walk into brick and mortar, or there's talent in order to access it. you're asking the person, the community member, to, as somebody mentioned earlier, navigate, know what the resources are, and get there. And so what are the opportunities for support to meet people where they are in community? Community paramedicine is one good example of that, but there are others as well.
Yeah, I heard education, meeting people where they are. That's awesome. Yeah, and then the hurdle being that level of awareness, and maybe even ability to get yourself to that brick and mortar building.
As somebody pointed out, you know, there's a big range for those that are seniors that are the aged community from 60 to 100 plus. Those that are in the 80, 90, 100 range have to think about their last days. So making available such things as writing a will, what to do, make final arrangements for themselves. Those are very important things that not everybody, I mean, I know people older than I am, and I'm 71, that don't have a will yet, don't know how to make one. It's easy what to do with your remains, because you just do that when you get your driver's license. You can do it, that is available to you, but you know, it's just, you know, who's going to take care of you at the you know, on those final days. I know my physician has offered that to me, and I still have to make that decision. So in our last days, all these little things that we have to put together so that it doesn't go to probate or some other difficult issues.
Yeah, so legal assistance, help navigating those decisions, absolutely.
Northwest Justice is a resource that can support some of that, not everything, but some of it.
That's really helpful.
And included in that, I've been kind of, it's something that's important to me, is in the state of Washington, we have doctor-assisted suicide. You know, what are the parameters on that? How is one able to do that? And that's included in those final days. So anyway.
Yeah, this is really helpful. I do also anything you want to add on this community-based support, education awareness? Right. And then I know we talked about mobile health and this access. Does anyone want to add the community-based paramedicine programs, or do I feel like we've addressed that in kind of prior areas? Awesome. And then just from the chat, person said collaboration with existing visitors as a result of Meals on Wheels, right? Thinking about who's already in the home, where are those connections already happening? How Christina said, where there's congregation, tapping into those folks to distribute resources. I think that's a great opportunity, Preston. Thank you for that. And then in our last 5 minutes, let's see what goals we have. So navigation and resources, and then workforce. So in our last few minutes, does anyone have some solutions or hurdles for these goals?
I think when we are being mindful of accessibility, that we want to know, or we want to remember that some older adults need in-person or telephonic over digital. And sometimes they just need more time than what's traditionally allowed during a visit.
Yeah. Yeah, and since we only have a couple minutes left, to kind of open this up globally, is there any other solutions or hurdles kind of in general anyone want to make sure that we got into this meeting before we all let you have lunch? Anything we think we missed? Well, if not, I will use our last couple minutes to close this out. Give me 1 second. There's too many. How about digital needs? There's just too many screens. I just want to make sure that I thank you all today for taking this hour. Many of you I've seen at other meetings, and you've really dedicated a lot of time to this effort, and we really, really appreciate it. Like I said, after the holidays, after the Thanksgiving holiday, before Christmas and other holidays, you'll see these on the website, and then with the recording, so you can watch your own meeting, other meetings, send them to friends. There'll be an opportunity for people that maybe couldn't attend these meetings to add their solutions and hurdles, so that we can be reading those as an internal team with staff to really make sure we're getting problem definition right. You can also email me or call me. I'm the one that invited you to this meeting, so my information is in that invite. Feel free to reach out anytime, and we can talk about those things as well. And then you may be just hearing additional emails from me, reaching out to get more information from you, especially if you're the service provider. And then certainly in the new year, you'll all be invited to those workshops. So we're really excited about this plan. I think, there's some heavy issues I think we all explored today, but there's some really good opportunity here. And I can keep hearing about some of the fantastic work that's being done across the county, and just starting to connect those dots better to really make Clark County a really great place to age in. And with our last 3 minutes, I'll give it over to Susan to see if she has any final notes as well.
Thanks, Rose. I just want to echo some of the comments you made, and I know everybody is really busy and you have a lot of other things you could be doing. So we really appreciate your time attending today and our other sessions. So thank you all.
Thank you.
Thank you.
I hope you all get something to eat and have a fantastic weekend and a good Thanksgiving.
Thank you.
Thanks.
Bye.
Bye.